very much for joining us once again in Lagos, Nigeria. The One Campaign and our partners here today are always very proud and happy to be here because we work with you as one all the time to try and effect the change that we need ourselves in Africa and today in Lagos, Nigeria. Without much ado, please allow me to introduce to you the panelists that will be speaking with us today and telling us more about this great campaign that we are going to be launching.
Thank you very much, Edwin. Ladies and gentlemen, special guests, our partners in this campaign, thank you very much for making time to be with us here in Lagos today. Today, of course, is World Malaria Day, which is being commemorated around the world, and there have been numerous programs on television, on radio, and in print about what this means in Nigeria. Progress is being made in Nigeria on malaria. It's slow, but there is some progress being made. But that's not why we're here today. I'd like to introduce one to you. For about 10 years, as part of the international development community, the One Campaign has advocated tirelessly in support of smart policies, effective programs, and financial resources to help end preventable diseases and enable citizens to lift themselves out of extreme poverty, particularly in Africa.
Good afternoon, sir.
Hello, good afternoon.
How are you, sir?
Waji.
Sir, how are you?
Pleasure.
Chindu. How fine.
Thank you.
Nice to meet you.
Pleasure.
Let's go inside.
Seeing you here.
Thank you.
It's great. Good Friday started like a normal day for us, but this time around it was a special day for us because of where we worship. We are Catholics, so on a day like that, we usually reenact the Passion of Christ. And my phone rang. I said, "Yes, mommy." But Christopher answered, so it's the one calling. Mommy is written in pains. I said, pains? By the time I got home, the kind of pain I saw her in was something I've never seen before. The place we were kept, there was no light. So when it gets dark, the doctors could not see. It's my phone that I had to use, put on the torch light in my phone. That's what they were using to trace the vein. They punctured her body. In fact, at a point they went to the leg. There was no place they did not search. The first one tried, the second one tried until perhaps the more experienced one came before they could now get to where they can at least take blood and then give her injections from there. But I didn't know that they had a caveat in their word that the patient's relation cannot stay in the ward with the patient. I never knew about that. I was literally pushed out of that place. I left, and as I was going, my wife was saying, "Daddy, don't go. Daddy, don't go. Daddy, don't go." I just wish I listened to that voice. I just wish I reacted to that voice. Because they made me go. And I left only for me to come back the next morning with Christabel to go and clean her. And then the curtain had been drawn on my wife's bed. As soon as I got halfway and saw it, life went out of me. The nurse now came and said, "Oh, God, please wait." I just shoved her aside, opened the curtain, and I saw the lifeless body of my wife with my first daughter. No information, no nothing, no phone call, nothing. They didn't do anything. And one of the things they said in their report is that they discovered my wife dead when they were going on ward round.
It's a great honor to be sitting here right now, not just as a musician, but as a woman, a mother, and a citizen of this great country. And I also want to personally thank Mr. Udebu for telling us his story, because many times when we hear stories like that, or we watch movies, or we see things that affect our society, because they are not very close to home, we think these things don't concern us. But it does concern us, and this whole campaign is centered around health, and we called it "Make Naija Stronger," because you cannot say we're a successful society, a successful country, or a successful people if good health is a myth, when it comes to us.
I worked and lived among the very poor, the rural poor in Nigeria for some years right now, and I have seen an unimaginable level of poverty and disease among the rural poor that could make you conclude that only God sustains the poor in Nigeria. Nigeria has a double burden of communicable and non-communicable diseases, but diseases plague the poor even more than the average Nigerian for obvious reasons.
Currently, Nigeria has no public health system. I think we should not even doubt it for 1 second. It does not exist. There is a skeleton, there is an intention, it just simply does not exist. And what we are going through now every day is nothing short of the normalization of poverty.
In 2000, the World Health Report rated Nigeria, he was alluding to that, but rated Nigeria 187 out of 191 countries in terms of health system performance. And the countries who were better than, they are basically countries that were then Sierra Leone, Liberia, Somalia, and that kind. And some of us sat down to try to interrogate, because I think part of the problem is we have not sat down to really understand why do we have these problems.
Active citizenship needs a little bit of development. We need to go back now and say, okay, if we really are interested in putting health on the agenda in Nigeria, we have to educate ourselves first. Then we have to do something that a group called budget has done very successfully. So if anyone has looked at the Nigerian budget, it's the most impossible to comprehend document you can imagine.
We've got 2.3 million members at one. We've got coalition with civil society organizations here. If each of those 2.3 million members send a message out to 5 people, that's really no further than their immediate family. That alone is 11.5 million. And each one of those then feels obliged to, maybe 2 people there. That's already 23 million people in Nigeria. That's a substantial amount of people. And that can be done. Nowadays we have technology, we have emails, social media and so on. And we have mobilized our members before successfully in Nigeria and other campaigns. The Do a Greek campaign, which some of you have heard of. We were hoping the Coco Master who led that campaign would be here, the badge. And that has achieved great things, not just in Nigeria, but elsewhere.
I thank you for this campaign, and I believe that indeed the medical revolution has started. Everybody has said a couple of things, and I believe that we must call a spade a spade. I was very glad when Dr. Francis was saying that they in the ministry know about the rot in our hospitals, and it made me even sadder. It made me sadder. What have they done? Is it when people like me have lost their loved ones that they will now sit up and do their work? What has the government done? The chief medical director is still on seat. Have they set up an independent panel to exactly know what happened to my wife? Something needs to be done when a tragic event happens. It took only one life to start the Arab Spring. Just one life. And my wife is going to start that medical revolution in this country.
One of the things that is of great concern is health, maternal death and everything, and that's part of what one campaign is trying to do, to have the government invest more in the health sector so that we wouldn't have the high rate of maternal death as it is now.
The Senate, they should make the right policy. They should mount a little more pressure on the executive, and we also call on Buhari administration to pay more attention to the health sector.
Everybody comes together as one and put their voices together. So I've signed the petition, I'm calling everybody out to go there, one.org, and sign the petition, be part of the campaign, Let's Make Naija Stronger.
When you take an oath to a profession, you should abide by it, whether you are being paid or not. And saving life it should be of paramount importance to any society. So I would want to see them change attitude, attend to patients when they get them. Let's know we are fighting a different war when it comes to them getting good pay, but let them do their job as it's supposed to be.
It's a start of citizens being part of the issues, taking the issues in their hands, real issues. So for me, it's been a success all the while. I like the passion, I like the response, I like the people's push for it. It's real story, it's real life, it's real people, and that for me is a success.
First and foremost, save life before you start asking for either money or other things.
They've got 2.3 million members in Nigeria. That's almost 1/3 of our global total. So Nigeria is important to one. Our members are active, and we believe if they sign the petition, if they write letters, if they mobilize their communities, their voices will be heard at local, state, and federal government levels, and this will make an impact.
Your destiny is bound to the destiny of others. We need your support to make Naija stronger.